You may be shocked, but some doctors will go on a weekend course for 2 or 3 days and they will do breast augmentations or BBLs. This is Dr. Shim Ching, based in Honolulu, Kauai. I'm a board-certified plastic surgeon, and I am going to describe what is the ideal situation to make a great plastic surgeon when I look at my colleague, the people who've trained me, and what I aspire to practice and for myself. There are 4 things that I'd like to touch on. The first thing is training. Second thing is skill. Third thing is experience. And the fourth thing would be artistic ability, which is very critical in plastic surgery. The 3 things that I first mentioned are applicable to any type of surgeon, but in addition, plastic surgery draws on artistic ability to give patients the best result, the most beautiful result, the most natural result. Other surgical specialties can incorporate artistic tendencies. However, you can't really see how beautiful the surgery was on the inside, but in plastic surgery, everything is on the outside. It's very important and even more critical that the surgeon has that ability. And what really is that ability? Well, artistic sense is a very subjective thing, and you can't really quantify. You can't really say somebody has it and somebody doesn't, because one person's idea of beauty may not be another person. What you have to do is align with somebody's artistic sense, and you can get that from their before and after photos, the work that they've done before, just to make sure that their concept of beauty is in line with yours. That's something that's very important in selecting somebody. But I do feel that the best plastic surgeons will have the kind of artistic sense to create the most beautiful, the most natural, and the best results. The first thing that I talked about is training. Training in any sort of surgery takes a really, really long time. Not only do you have to do 4 years of university, there's 4 years of medical school after that. In North America, so there's that first 8 years where you're basically just studying and going to school. After that, all doctors will specialize into their specialties, and plastic surgery can take anywhere from 5 to 8 years, depending on where you train and what you like to do. In addition, a lot of surgeons like me will pursue additional training after that 5 to 8 years and spend another year or 2 further developing their skills and experience with a very specific part of plastic surgery. All that training really develops a surgeon and what they can do. And skill is very important in that. If you are skilled with your hands and your eyes and just being able to piece together 3-dimensionally a patient's issue and the surgery and all those things, they go kind of hand in hand. But without the training, my feeling is that you can't really achieve what somebody can with all of that background and training and knowledge. This is important because in plastic surgery or cosmetic surgery, there are many different types of doctors. And I myself took about 15 years for all the training after high school. Over that time, I really developed as a surgeon. You may be shocked, but some doctors will go on a weekend course for 2 or 3 days and they will do breast augmentations or BBLs or procedures that I find quite complex. And I don't think I could ever properly do them after 2 or 3 days of experience. And that's really a distinction between a plastic surgeon or a facial plastic surgeon who's done similar kind of training to me, and other surgeons that might call themselves cosmetic surgeons that are usually other specialties, non-surgical, like internists or ER doctors or all sorts of other types of doctors who get much more limited training and do these procedures. And I do feel that the outcome, the difference, the result is different when you look at the 2 types of doctors who are doing cosmetic surgery. We've covered artistic sense, we've covered training, we've covered skill, which is a very important part of being a surgeon and something that is developed over time. Generally, if you're not skilled with your hands, you're not going to go into surgery. And the last thing is experience. When surgeons first start, you are good, you have a lot of experience behind you, you've done a lot of things, but cosmetic surgery and plastic surgery isn't really taught when we're developing our skills as a resident. In those instances, in that time, during that training, we're really focusing on the reconstructive of surgery. And reconstructive plastic surgery is very important. That's really how plastic surgery started in World War I, where people were mutilated as a result of the war. The surgeons started to reconstruct those people to make them look better and be functional in society. And that's really the roots of plastic surgery, and that's the root of my training. And we take a lot of what we learn in reconstructive surgery and apply it to cosmetic surgery. I think it's a very good complement to what I do, all of my prior training. And then in addition, I've been in practice for about 20 years now. I can really draw on all the experience that I've had before, all the cases I've done, all the difficult procedures that I've done in the past to give patients the best result, drawing from all my prior experience. I hope you enjoyed this video. Next video, I'm going to be talking about the importance of the patient relationship, the relationship between the surgeon and the patient.